Hi, good evening, good afternoon. How are you all? This is Priya Verma, your course coordinator. Thank you for joining the session. Greetings, Andy sir.
Greetings. I trust everything is okay. I see Nancy is with us already. So
Yes, she has already joined. Hi, Nancy.
Hi, how are you?
I'm good.
Fine.
So, Nancy, we're gonna start in next 5 minutes. Let people join in the session, okay?
Okay, sure.
Okay. Okay, so I guess it's already 5 to 5 India time. So we should start with the session. So first, I would like to introduce with our new speaker, Nancy Ahmed Yusuf. Hi, Nancy. How are you? Again, Nancy, am I audible to you?
Yes, I can hear you now. Okay.
Hi.
Hi, everyone. Good morning, good afternoon. It's my pleasure to join you today for the expert session number 8 on PSM support functions and system. I will introduce myself as I am Nancy Yusuf, technical advisor in supply chain management. I previously worked with JSI and Ministry of Health with different areas related to the logistics and the reproductive health. I have more than 13 years experience in different aspects in supply chain management, dealing with drug authorities, Ministry of Health, and USAID funded project. I'm a pharmacist with a master degree of business administration plus total quality management diploma, and of course, procurement supply chain management diploma from Empower School. Plus many other courses related to logistics and supply chain management. So we will start our session today. Okay. Give me 1 second. Okay. We will talk today about Module 8, PSM support functions and systems. So we will start about the, sorry for interruption, I have 2 screens. Okay. We will start about some announcements. Kindly mute your microphones and turn off video for better connectivity. And please ask questions using chat box and raising your hands. You may ask questions in the chat box at any time. It's our pleasure. And when and only when you are invited to speak, please remember to unmute and turn on your video. This webinar recording will be available in Empower School channels, and the slide deck will be shared with all participants. Today, this webinar objectives will talk about the PSM support functions and system to give you a chance to review a module and ask any questions. Sorry, I have too many messages. Okay. Okay. In this course, the speaker will summarize the module, then invite questions, and finally indicate how we can self-measure our progress and skills achievements as we move through the course. Okay, our agenda, we will do the introduction and the instructions, which we done. And we will start by the key points with about 20 minutes. And then we will have the first session for the questions and answers. And then we will rejoin for the part 2 presentation and then the questions and answers session. Okay. As we all know that the procurement and supply chain management have a core areas, starting from product selection, forecasting, procurement, inventory management, distribution, and rational use of medicine. And we have an overall framework for supply chain. We have a policy, we have functions, and we have the resources. Under the policy area, we have national organizational policies, and we have a strategy, roadmap, and the guidelines. These policies will organize what is our work and how to be implemented, and what is our strategy for the project if we will make a development, or we increase our supply, or we introduce new products, new services, and the guidelines for dispensing these products to ensure the rational drug use. Okay, and for the functions, we will have a supporting functions like quality assurance, data management, coordination, communication, and risk management. And please note, these supporting functions listed in this diagram, not only the unique, no, we have so many supporting functions, and we're just listing the main that we can't avoid. So these supporting functions will support the core functions: selection, forecasting, procurement, storage, distribution, till dispensing the products. And we have a resources, financial resources, human resources, physical infrastructure, and IT system. Financial resources as the money, human resources as the people who can implement these functions. Physical infrastructure, including the warehouses, including the offices, including computers, hardware, and so many physical infrastructure, and the IT system which will support these functions. Okay. As we have seen this PSM cycle, we have the components of the procurement supply chain management, which started from product selection, forecasting, procedures, procurement, inventory management, distribution, and ensuring the rational use. This cycle not ended, and it is continuous cycle and intersected. So we have an areas where the PSM staff have a major inputs, like the product advice of the formulation, like VIN analysis and ABC seasonal variation of the substitutes, like identifying specifications of the quality assurance and the quality control, like identifying the high value items and the stock levels, minimum, maximum, safety stock, buffer stocks, which, okay, I hear a voice. Okay. And to identify the storage conditions for these products. And we have the technical transport conditions, if we have a light sensitive, if we have a heat sensitive products. So we must identify the specs to ensure the product quality throughout this PSM cycle. And we have to identify the MIS and standard treatment guidelines formulary and the measurements. And as we know, the procurement and supply chain management stakeholders are many. So we have many challenges to retain the balance while being pulled by different stakeholders in different directions. If we can look to this diagram, we have a PSM functions, which we are talked about it before, and we have a different players, different stakeholders, like Ministry of Health, regulatory authorities, international regulatory and multilateral organizations, the manufacturers, trade channels, donors, logistics service providers, clinicians, and health workers, clients. Please mute your mic, please. Could you please mute your mic? Okay. And we have a civil society and non-governmental organizations, industry bodies, and we have a program management staff. So these players have some inputs, and we will affect them, and they will affect the procurement and supply management cycle and functions. So the goal of the PSM cycle and function is to improve the health outcomes and build trust in health system. They should be patient-centered and give access to affordable, high-quality products when and where they are needed. Procurement is a critical part of the logistics cycle. If we look to the diagram appeared below, we have at the heart the LMIS. Sorry. The LMIS, pipeline monitoring, organizations and staffing, budgeting, supervision, evaluation. And we have serving customers to be patient-centered, and we will do the product selection, and we will do quantification and procurement, and we have inventory management, storage, and distribution. And through this cycle, we will do the quality monitoring. And we have a policies to adapt with. And we have to build our system to be adaptable to any change, to be resilient. So the procurement is a critical part of the logistics cycle, and the planning for the procurement and the procurement processes are important activities that ensure the correct products are available in country and are ready for distribution when they are needed. Without procurement procedures and processes, you wouldn't be able to meet these 6 rights. Okay. We have in this diagram talking about the procurement. As a procurement is a decision-making process you follow when you buy products. You usually have many options. Which option is better and which is more economic and which is powerful? This decision, not an easy decision. So this involves the transfer of money, frequently substantial amount of money. Most of the procurement processes focus on making it as fair and competitive as possible. This diagram and its source appeared below. We have a different components. We have the manufacturer, we have the procurement process, we have the storage and distribution, and we have the service delivery. In the manufacturer, we need to ensure that this supplier or this manufacturer comply with good manufacturing practices accepted in the country and ensure it's comply with identified and agreed lead time. And for the procurement, we have a policies and procedures that we have to follow. And we have a funding cycles, whatever it is donor or governmental or related to the finance department. And we have a contract and supplier management. And also we have a storage and distribution. We have inventory management. We have a cold chain management. We have a distribution planning, which route to be used for distribution, and the schedule for this distribution, and how to ensure the quality of the product during the distribution. And also, we have a service delivery, the national treatment guidelines, and rational drug use. So we have a medicines and health commodities transferred from the manufacturer till the service delivery and reach the final user, the end user. And we have a money and finances transferred from the service delivery point till be paid for the manufacturer. So after you complete the product selection and the quantification process, the information is submitted to the procurement unit to obtain the correct quantities of the correct product from international, regional, or local marketplace. We have seen that this information as a cloud. This information is the core part of this cycle. And we have a cross-cutting functions. We have to have essential medicine list and to be updated. And we have a regulatory frameworks to comply with. And we have a national medicine strategies to comply. And we have a system performance to be measured throughout this cycle. And we have to ensure accountability to achieve health governance. And we have to keep monitoring the quality control of the products throughout this cycle. So the procurement function provides critical opportunities to achieve supply chain cost effectiveness. For example, it is estimated that the government of Cambodia could have saved up to $50 million annually by more efficiently in purchasing pharmaceuticals, equipment, and medical supplies. The country was paying on average up to 6 times the international reference price of essential medicines. The World Health Organization has estimated that by reducing unnecessary expenditure on medicine, countries could save up to 5% of their total health expenditure. So it is critical. Supply chain cost saving can be achieved by implementing strategic purchasing methods, which continuously seek to improve the health system performance through purchasing decisions. This is contrast to passive purchasing, making procurement decision based on available budget, or simply paying bills when presented. Procurement methods to achieve cost savings include the implementation of pooled procurements, enhancing competition through e-procurement systems, and entering into long-term fixed-price contractual agreements. Forward procurement planning and the timely submission of medicine and commodity orders, which allow the manufacturers to adjust production schedules well in advance, can also result in procurement price reduction. And this is the core of the procurement, to save money, to ensure high and best use of money. And we will talk about it later. So, what are the PSM support systems? PSM support systems are the management and implementation functions required for successful execution of PSM activities. Today, we will talk about the main, but not only the present one. No, this is the main function, support functions for the PSM. The first one is the organization and staffing of the PSM function. Number 2, PSM data and the information system pyramid, IT support. Number 3, implementing a logistic management information system. Number 4, risk management and planning. And then we have a quality assurance throughout the cycle. And then we have a financial impact of PSM, value for money, return on investment, and funding for PSM projects. So we will move now for organizations and staffing of the PSM functions. As we all familiar and known about the PSM as a function, to build the competence of supply chain professionals, efficient and effective supply chains require trained and competent staff to execute operations and meet health system demands. The skills needed to manage a supply chain include product forecasting, inventory management and analysis, and contract management and monitoring. These as a functions. So, managing price negotiations with suppliers and local customs clearance procedures, financial management, and distribution planning are also important to supply chain management competencies. In light of the critical role skilled and competent staff play in managing supply chains, health systems should invest in the training and professionalization of local supply chain staff. Please remember, all functions cannot be done by one person. We need specialization. For any successful process, you should have an effective organizational structure which mainly depends on the human resources. The human factor is the main one. PSM processes starting from quality assurance, manufacturing, supply, procurement planning, warehousing, distribution, dispensing to users, reporting, and analyzing all require specifically skilled staff, even when your program is highly dependent on technology. Even we have the latest technology, we will need the human factor who can manage and do the job using these technology. So, why does the health PSM workforce matter? Why? Strong health system and strong health supply chains are central to positive health outcomes. Health supply chains are people. Supply chain, depending not only on the financial and technical inputs, but also on competent, recognized, and empowered individuals to ensure that essential medicines and health commodities reach the people who need them and saves life. So, the human factor is the main one. Let's move to the number 2 for the support system required for efficient execution and implementation of PSM functions. We have PSM data and the information system pyramid, which is called IT support. We need available, accurate data at each level and its timely transmission throughout the whole process and activities. For example, quantification exercise or quantification review. Please, could you mute your mic? Thank you. Calculating stock on hand, stock out rate, lead time calculation, expiry date. All these calculation needs accurate and in time transmission of the data. Please could you mute your mic? Okay, no problem. Okay. So, having an optimally functioning IT system with trained and skilled staff is required to have available and accurate data with the timely transmission. So, I will give you a real examples of different types of data needed and how to collect and different scenarios happen in case of not accurate, unavailable, and not in time transmission or untrained staff, weak technology, and the effects on the PSM. During my previous work experience, I have faced we need to make a quantification exercise. This quantification exercise. Please mute your mic. Thank you. For this exercise, we need to know the stock on hand available. So at this time, if we can say at 20th of February, we need to identify the stock available at each level. And this stock in numbers at basic unit. And then we need to identify the stock available in the stores and the service delivery points as well at each level of the pipeline. If we don't have this data at this time, we can't do this calculation correctly and accurately. And also we need to know the quantities at this time and the expected delivery expected delivery dates. So these data need to be collected and transmitted to be gathered together to identify the stock and the expected addition and to what duration it will last to be able to avoid any stock out. And we need to identify the stock out rate. If we don't record this data, we can't reconciling this information available with us. And also, we will need to identify the supplier's capacity for production. These data, if not available at this time, maybe we have a historical information, but they increase their production capacity, so we can update our schedule and shipping, so we can identify which new schedule can be implemented for better and to avoid any overstocking. This is the main functions related to PSM data and information system needed. Information management system drives supply chain decision-making. Accurate and timely inventory data inform budgeting, procurement, inventory management, and distribution processes. These are numerous logistics and inventory management IT systems in the marketplace, including many open source. You can find it as open source for LMIS available on JSI website. Some are mobile, some are online based, some are cloud based. It is dependent on which your capabilities and your capacity and the money allocated and the technicality in your staff to be able to use. It is not wise to purchase highly sophisticated system and my staff can't able to manage it and to make best use of it. So we can use the compatible IT system with my skills available in my staff. And we have inventory tracking and reporting systems, invoice and delivery node generation, and restocking among the core functionalities in many of these systems. It can make the resupply order. It can calculate and make a warning sign if we reach the minimal level, if we reach the stock out. So this is alarm can support the human managing the procurement and supply chain management system. In more advanced applications, inventory management systems are able to interface with tender management, purchasing, or patient dispensing platforms to ensure the rational use of medicine. Knowing stock status at different levels of the pipeline with different users using message, email, printable, archived, or exportable. This all make better use of this technology when I have the trained staff to make the best use of these IT systems to manage PSM functions. So, when we will talk about the LMIS Logistic Management Information System, if you remember, it is one of the main functions in the logistics cycle, LMIS. It is the core of the PSM, and it is a tool that enables evidence-based decisions for both policymakers and PSM managers. LMIS can be manual, automated, or even mixed. LMIS includes data and reports, different formats and mechanisms to report and analyze data. LMIS supports in defining and measuring KPIs. And this is a link if you need to view OpenLMIS. Again, OpenLMIS in support to informed decision-making, improve data accuracy, improve data timeliness, increase accountability, and increase data visibility. Okay, during my work with Ministry of Health, we have to use our LMIS system. It is somehow mixed at the service delivery point. It is manual and then collected to the district level when it is converted from manual paperwork to automated or somehow automated, and then it will continue as an automated system. This information gathered by LMIS, including the start stock at the beginning of the period and the average monthly consumption and the dispensed or the consumed quantities and the price. So we can use the LMIS to identify our stock status, if it is between the minimum and the maximum, if it can give alarm if we face stock out, and if we need a resupply. And also we can see this information at service delivery points, at district, and at the directorate levels and the overall central level. And this information, when it is manual, we can face some errors in data entry. But when it is automated or even mixed, we minimize the effect of data entry error, which will affect the whole cycle of the PSM function. Okay. And also we made some improvement for this LMIS, which I am talking about, but we face some resistance. Some people resist to change, resist to use a new one, new modules. So it is needed to have some skills to manage people to minimize their resistance to change and advocate for the importance and the advantages of applying and using automated or mixed LMIS and how it can facilitate and make their work more easier. During my work also, we have some tasks related to developing LMIS system. We made like a series of workshops to identify and involve the human factor. What are needed? What is a draft or map of this task as their role? What are their responsibilities? And what is needed? What is the shape of the reports they need in their work? And which form to be exported, Excel, PDF, or Word, but it is mainly Access or Excel for better calculation and addition. And then we draft and collect this information from the functionalities and start to scratch which module we will need to design and the expected timeline and the expected and needed training and how to make the checks to minimize any error, and then build on the development of this LMIS and prod the application. These who resist the change and the application of the new LMIS are the most powerful users of this LMIS. So involving the human factor with any updates or development for the logistic management system will strengthen their capabilities and minimize any error and make their job easier, so they will support the development and the updates of the LMIS system available. So the LMIS, as we all know, it supports the functions and support to calculate the lead time and the level of the stock and the level of the safety stock needed. And this data is essential for ensuring the procurement processes results in correct quantity of commodities that will best support the program's projected needs. A forecast that is too low could result in stock outs, which will often trigger expensive emergency procurements, creating a financial strain on limited healthcare budgets. A forecast that is too high can cause excess holding cost, storage capacity strain, and an increased chance of product expiring on the shelf. As we all know, for the quantification, we need to know at each level what is the stock available, what is the losses and the expected and adjusted stock. And we need to know the average monthly consumption, and we need to know the cost per basic unit. So these data collected will be collected through the LMIS, and then we will make a calculation using the IT support systems, and we will use the data collected from the IT system and the LMIS to make the best use of money and make a wise decision. So, which technique to use dependent on how the LMIS you use or you apply is reliable. If the data accuracy is somehow not confident with, you can use different techniques in quantification. You can make proxy consumption. You can use service. You can use morbidity. But as we know, the consumption is the best used if we have the reliable data, if we have reliable LMIS. So we can make different decisions based on the data available and based on the accuracy we have. So now we will have the first question and answer session. Please, if you have any question, ask. Thank you. Okay.
Hey, I don't see anything in the chat box yet.
Yes.
So then maybe while we're waiting for people to ask their questions, I can just do a quick summary.
Okay.
I think you made an excellent presentation.
Thank you.
And you really made the point that we are interlinked. The whole of procurement supply chain is interlinked, and we are interlinked with the support functions. Talked about procurement. We can't do procurement if we don't have cooperation and interlinkage with finance. If finance don't pay our suppliers, none of our procurement techniques are ever going to work. And these are the support functions that we talk about and how we have to try and manage those support functions as well as all the procurement supply chain. And I think that's a really important point. The other point you mentioned is IT support. And we often forget this. We want to use the LMIS and we just want the numbers. We just want the data. How many of our computer LMIS systems have got any kind of cyber protection? Have they even got antivirus on there? Have we ever looked at that? And this is the kind of support function that we need. As a PSM person, you do not need to be a computer expert, but you need to know enough to know that you need a computer expert. We need this support service of IT. Without it, we can't operate computer systems safely and effectively. And we need all that specialist support, finance, administrative, IT support, and above all, we need advocacy skills. It's not enough that we know what to do. We have to be able to explain to others, explain to people in the Ministry of Finance what we are doing on procurement. And only with that explanation can we hope to do that. Okay, let's see if we've got any questions. I see we've got 4 chats now, so maybe we've got some questions in the box. Okay, well, question for you then, Nancy. How large should the procurement team be at the facility level? For example, a hospital which buys some of its products locally. You want to try and answer that, Nancy?
Yes, so yes, I opened the question. Okay.
Right.
It is better, as we understand that during this course, if we have a larger or collected procurement, so if we have gathering the procurement by different facilities to make better price, so it will be more economic to gathering. And we can start by making a suppliers list to ask which is the best suppliers identified, and the for a preparation before bidding, and identify their acceptance and their commitment and complying with good manufacturing practices. And then this is as identifying the suppliers. And then as a staff for the procurement at a hospital, we can collect the data about the actual consumption with identified specific time. And it is not advised to be long time and not short time. With an average 6 months is better to avoid any changes in the consumption pattern and to make some flexibility for any seasonality or updated products in the current method mix available. So we can gather these numbers and identify the potential suppliers period the bidding. And as we all know that procurement locally is much easier with lower, shorter time for receiving the commodities, better than internationally or more wider procurement process. So the procurement team, how it should be large, the number, there is, during the course, we have identified this calculation based on the total cost identified for the procurement cycle. Per each dollar, we have a percentage of employees, but as we know, we have some commodities with low value and some will be of low volume. So compromise between these two rules to specify the needed number of the procurement team, and it is about with an average 10 to 15 member, it will be somehow accepted, but it is dependent on your program itself. Professor Andy, if you need to add.
Okay, what I will say here is our general, because countries are of very different size. So if you're a low population country like Lesotho with a population of 2 million, that's quite a different procurement team from Nigeria with a population over 100 million. Yep. So generally speaking, as a very crude guide, one procurement person per $1 million of procurement. Okay, that's a very crude guide for the hospital level. And as Nancy says, doesn't mean that you as the hospital have to place everything from the beginning. If you have national framework contracts, that makes it a lot easier for you to be able to procure. You still have your own budgetary control that you can procure for the framework contract. But very crude guide, and you'll see an exercise, a case study that you do in the course based on numbers from Botswana, where we have very detailed numbers. You can analyze the numbers and see it is in the region of about one person per $1 million for the hospital level. At the national level, about one person per $5 million of procurement. Very crude, but a rough guide. It depends very much on what kind of commodities you are procuring. If you're buying antiretrovirals, they are high cost. You don't need many staff to buy $1 million. If you're buying paracetamol, they are very low cost. It's a complex operation. You need more staff. But the guide is one person per $1 million. Okay, shall we move on to the next question? How can we make the team work with different attitudes and backgrounds of training? Some less aware, some more aware of medicine procurement. So when you've got a mixed team, how can you make procurement work?
From my opinion and my experience, it is better to identify the role and the needed responsibilities per each staff member. So this will facilitate and make the job easier. For example, we will identify the specifications needed. So we will have a committee and identified members to identify the specifications of the raw material and active and inactive ingredients. And we have to know the specifications of the product labeling and packaging and the specifications of the paperwork. Each component of these specifications have different members to identify. No one is aware of all of these qualifications or specifications. So we have to make a committee. In my job, we have a committee called Technical Specification Committee to identify 1, 2, 3. If we can say this is the raw materials and the packaging and labeling. And they can use or consult any staff, trained staff from different departments to add their inputs. For example, physicians, for example, supply chain professionals in different departments. If we can face a reduction in the number, so we can consult any of the support staff. Then we will have, after this specification, we have to identify the length of this cycle and the lead time, the paperwork needed, the financial fund allocated. All of these data, we have different players who is responsible for doing this. And we have a mapping. For example, we have a person. This person is newly joined. So we will train him about the technique, the procedures, and the needed work, needed paper, and what is expected from him, and the due date. And then making on-job training. And if we have flexibility in time, we can make a rotation between different committees. And I called it as a committees based on my experience. So this committee can involve him as a volunteer, but not his main job. So this culture of sharing duties will enrich his skills and enrich his background. So it make him somehow familiar about the process. And if we have a budget allocated for training for the procurement staff, we can enroll more and more people who join the team. For my experience, we have a training for the procurement staff on quantification, the whole staff. And as we know, not the whole staff is responsible for quantification, but to make them aware about the techniques and the value of each step in the procurement cycle and how it make more valuable and more committed. And if we can measure the performance after and before this training, it adds more and make our job much easier. Also, as we know, for somehow governmental representatives, we don't select people who to join, but we can build their capacity. We can somehow increase their knowledge. So move their attitudes toward more effective and minimize any obstacles or barriers from their previous attitudes. But in the private sector or other sectors rather than the governmental, we can select, identify the job description, the needed skills, and make like a program for training throughout the expected life of this staff in this team. And hope I reply to your question. Do you need to add, Professor Andy?
No, I think that's good. We've got a question probably for Priya here. The last two session slides have not yet been shared. I think they have, but we'll let Priya respond to that on the chat box. Okay, the next question for you then, Nancy, is in regards LMIS, can we have any name of an IT system designs that can help to analyze our data information? I think the short answer is no, there is no one size fits all. And
Yes.
you've already given the reference to the different ones that are available on the JSI analysis of the software. And please go ahead.
Yes, during my work, I will give you an example. We have a software called Pipeline. This is owned by JSI, and it is very wonderful source as an IT system. But we have some barriers or obstacles with who can use this software or this IT system. For example, language barrier. For example, the technicality of the stuff. So no one IT system can fit to all programs, all countries. Somehow the programs available are identifying some products specifically. And as we know, the essential medicine list is updated periodically. So we need to upgrade this system. If this system is open source, so we can't obligate the owner of this program or this system to update it. And also if we have tailored programs, if we can talking about antiretrovirals, some countries were talking about reproductive health. So every day we have a new products, new techniques, new schedule for shipping and ordering and how to monitor these. So we can't use a specific or unique IT system. Also, during my work for developing a new LMIS system, we listen to the customer who are the workers at different levels of the supply chain. They need the LMIS system generate reports, so many reports, but what is the best use of the reports? Unless I have the specialty and the technicality experts who can use these reports. So we can't use unique system, and we need to identify the priorities which I need to build my system. For example, as well, during my previous work with Ministry of Health, we have paperwork LMIS, and this system used in different program. When we applied in our program, it don't fit, it don't match, it needs some changes. These changes may affect the core of the LMIS, and even in the same country, we can't apply a unique LMIS. So as Professor Andy mentioned, of course, no, we can't use only one IT system. Thank you.
Sorry.
I see. Oh, okay.
Okay, I think we better stop there and come back to the presentation, and we'll try and answer the rest of the questions in session 2.
Okay, sure. Thank you. Okay, then we will rejoin about the support systems required to execute the implementation of PSM functions. We talked about the first 3, which is the human factor, staffing, and organizing. And we are talking about the LMIS, the IT support system. Then we will talk about risk management planning. For proper implementation of any activity, proper planning is needed. One of these items is RMP, which lists different risks with estimated impact and mitigation plans. It is a continuous process that needs to be reviewed and updated regularly due to a large number of factors and players involved. We have a risk. We have to identify, we have to analyze, and suggest a list of actions, and to monitor our process and monitor this risk management technique, and to control to mitigate these risks. Here are examples of different steps in PSM and possible risks. If the managers need to define the supply requirements, so what are the possible risks? Inaccurate or not done at all. Inaccurate supply requirements or not done at all. Or if we are talking about the government budgeting process and approvals, the budget cycle timing is out of synchronize with funding. If we are managers and we need to submit the procurement requisitions and specifications, these requisitions may be not submitted on time, or inadequate or missing specifications, or specifications changes made after procurement process is initiated. It is outdated specification. If the minister releases funds to procuring unit, the time is out of synchronize with resupply needs, or midterm budget cuts or program fund with it. If we are talking about the procurement as a planning process, we need to assess the procurement options, plan the contract groupings and procurement schedule. So the possible risks, slow processing within the procurement unit, delayed inputs and approvals, uncertainty over dates and amounts of funds available. When we are to prepare bidding documents, obtain approvals, the possible risks are slow or flawed preparation of draft by the procurement unit itself, slow or flawed decision-making at levels above the procurement unit, slow processing by funder or monitor, revision of documents required. If we are in the process of inviting the offers, advertise opportunity, provide bidding documents, hold pre-bid meeting, respond to questions by potential bidders. So the possible risks may be bid deadline extended to accommodate necessary amendment of bidding documents. If we are to select the suppliers, obtain approvals, we need to open bids, prepare preliminary examination worksheet, deliberation and decision by bid evaluation committee, submit decisions for required approvals. So the possible risks may be slow preparation of examination worksheet, disagreements between the unit, slow approval processes, rejection by monitor based on unsupportable decision or flawed process. And we are talking about award contracts, notify successful bidder, publish results, negotiate minor points, process acceptance and signatures, obtain performance security. So what will happen if we protest by losing bidders, cancellation of bid, irregularity in performance security? If we are in arranged payment guarantee, down payments, letter of credit, delay in processing by finance unit or Ministry of Finance, fund not available to collateralize letter of credit, make down payment, these all will affect the PSM functions. If we are talking about manufacturing, processing lead time, if raw material shortage occurred, if overbooked manufacturing schedule, if distributor issues. As you know, we faced COVID-19 implications on supply chain management. The manufacturer faced massive effect due to the changes and raw material shortage and the distribution disturbance. This will affect the schedule for shipping and receiving the commodities. If we are talking about shipping, pre-shipping inspection, testing, what will happen if we failed and dispute results? Delivery to port of entry, if we face shipping problems. Custom clearance, and as we know, it is a time-consuming step. What will happen if slow processing of documents, no access to fund for port fees, irregularities in goods or documents, pharmaceutical registration issues? So we need to have a well-established procedures, identified, accessible, and make the supplier aware and agree of the Incoterms to be used, and make the contracts clear to avoid any of the delay can be occurred due to custom clearance. Post-shipment inspection testing. Delayed or failure of post-shipment inspection, testing, slow reporting, and or release will affect the PSM function. So I will refer you to the document. This is a very useful guide called Risk Management for Public Health Supply Chains. This is a toolkit for identifying, analyzing, and responding to supply chain risk in developing countries. And here is the link to be accessed easily. So after identifying the risk and manage this risk to mitigate its risk and minimize its effect on our cycle to ensure the high efficiency of our procurement cycle. Let's move to the next support function, which is quality assurance. It is important to talk and to implement quality assurance. And the purpose of the procurement supply chain management is to provide the right patient with right product in right condition and right price at right time, 7 rights. So we need to ensure the quality assurance. Different examples for quality assurance like operational cost reduction, focus on core business, better turn time, greater control, rising efficiency, process optimization, structured reporting, releasing internal capabilities. So quality assurance includes developing standard treatment guidelines and trains the service providers to be able to prescribe well to the patient, to make the patient comply with them, and to make the rational use of the medicine. And raw materials and manufacturing. Industrial pharmacy, we need to ensure that the final product started from the raw materials till be the final product. All of these processes occurred with good manufacturing practices and ensuring the final product is of high quality, accepted quality. Okay, right packaging and labeling that matches with user needs. User needs including the procurement staff and the end users, plus the quality checks throughout the supply chain, including storage, distribution, post-marketing, pharmacovigilance. All of these steps need quality assurance. The procurement unit must ensure that in addition to the product information provided by the program managers, including generic name, dosage, formulation, unit packaging requirements, suppliers must produce products that meet regulatory and shipping packaging requirements, including proof that products are manufactured at facilities that meet the good manufacturing practice certification requirements or have World Health Organization pre-qualification status, and that they can provide products that meet certain technical specifications, including standards for raw materials, dextro, levo, anhydrous, hydrated form, like these, and requirements for shelf life. for my country experience, they need the product with at least 3 years shelf life. Some countries ensure their product purchase to be more than 3 years. Somehow they can accept the products with lower shelf life, but with specific conditions written in the contract to avoid any expired products. And labeling, the language used, the inner and the outer packaging. Again, we are talking about these specifications for both end users and PSM staff. Technical specifications include testing requirements for quality assurance, packaging and shipping requirements, if it is heat sensitive, if we are talking about vaccines, if it is thermally specific or liable to be affected by light. These specifications are the primary way that countries protect their populations against counterfeit and substandard products that also help ensure that the products are properly labeled and adequately protected from heat and cold during shipping. And as we know, we have different indicators to monitor the thermal exposure of the products during the production till reaching the end users. And we have to compromise which is best, my budget and my need to select. Okay. As a part of bid, quality assurance specification should also be clearly written, identifying all documents that the purchaser will require from the supplier, including manufacturing records, certificate of analysis, test data, and regulatory certificates. And if you can remember, refer to different modules, we have to identify the sampling technique and the cost of this product. We have a high value products and low cost products, and the sampling techniques used in different situations. These specifications should also detail the plan for inspection by the purchaser, product sampling procedures, and the manufacturer process for sampling their product lots. Countries may involve many of the key stakeholders mentioned above, as well as technical specialists to ensure that the product specifications are followed and are complete. If my capability is not to be dependent on my staff, I can outsource part of these functions to ensure it's matched and comply with my requirements. We have a product quality assurance. As we talked before, counterfeit and substandard products are in marketplace. So, creating significant product quality risks for the supply system. We need to cure, not to cause any damage or any disease, illness. To address this risk, public sector procurement processes and national regulatory agencies must implement appropriate quality assurance measures to ensure that the only quality products enter the supply system. Procurement addresses this responsibility through the technical specifications issued with the bidding document that identifies key product quality requirements such as product certification requirements, pharmacopoeia standards when applicable. Again, labeling and packaging requirements, shelf life requirements, all these requirements are needed. These requirements become the contractual obligations that the supplier must comply with when a contract is awarded. The bidding and the contract documents should also include the right to conduct pre-shipment or post-shipment inspection and testing as required to confirm that the product complies with the stated quality assurance requirements. And we have to monitor the quality during the procurement. As with every other function in the logistics cycle, you should consider the quality monitoring during every step of the procurement. The quality must be a part of every step, from the determination of what to order through to the recipient and the acceptance of the products in the national inventory. You should monitor all procurements to ensure that product specifications and quantities are precise and accurate, that the bidding process follows regulations and procedures and is documented appropriately, that contracts are written carefully, and that you receive the correct products in good condition after shipment and delivery. So the quality assurance is needed throughout the procurement cycle, started from the manufacturing till dispensing the product, to ensuring the safety and the quality, and to ensuring the rational use of money and the medicine. Let's move to the number 6, which is funding. To achieve the 7 rights of the procurement cycle, we need to have suitable fund to ensure the availability of the products and services. Based on the available fund allocated and the source of this fund, different PSM decisions are taken to ensure the sustainability and the progress of any plan. When having a deficit in fund allocated, the decision will be selecting lower costs products or decreasing the requested amount, which will affect the rational drug use. When the source of funding is not continuous source, donor, not a governmental, this can affect the availability and the sustainability of the fund. That can be a challenge for strategic planning and make more focus on having skilled staff in the PSM team who is capable for advocacy to advocate to generate more money and negotiations to get more fund from different sources. In many countries, delay in funding allocation and release faced as a risk when we talked before about risk mitigation plans. So the national policies require that funding for procurement will be allocated and available to the program or procurement unit before bidding documents can be publicly released. Delays in government funding approvals and allocation of program procurement budgets delay the release of bidding documents, which in turn can delay the eventual delivery of the commodity. Donor funding cycles may also create delays in the procurement process if their funding cycles are not aligned with the government procurement cycle. Delay in supplier payments because of national cash flow and treasury management constraints can cause suppliers to hold shipments, and this can lead to supply problems. Now we will move to the function number 7, which is financial impact. There are different techniques to assess the financial impact, value for money, return on investments, and can be optimal when balanced with economy, spending less, efficient spending well, and effective spending wisely. The most widely used criteria for assessing value for money and return on investment are accessibility of medicine, rational medicine use, equity, sustainability, efficiency. And I will refer you for the free online course available on Empower platform about the financial evaluation of different investment in health procurement supply management. Recognize that the health implications and monetary values involved, no product, no program. Modern medicine require medicines. Commodities are typically more than 40% of the total health budget. So now we talked about the main PSM support functions and what is the intersection between these systems and how they affect the performance of the PSM cycle and how can we enrich the capabilities to make the investment in the procurement make greater impact on the health programs to reach the best use of money, to reach the most economic decision, access the highest quality or the accepted quality of products, and ensuring the treatment and they comply with the treatment guidelines, rational drug use of medicines. So all of these aspects affected by the PSM support functions, and we need to be aware of them and to comply with the listed with the best practices in each function. Again, thank you so much, and let's move to the second question and answer session. Okay.
Okay, if we take up where we left off, then talking about LMIS, the key challenge for an efficient LMS is the accuracy of the data. Efforts may be deployed to that aspect of data quality. Okay, well, I think we can all agree with that, but perhaps, Nancy, you can give us some of your experiences on data quality and LMIS.
Yes, we made some rules at each level for the LMIS. At the service delivery point, the data entry people will enter the data at the beginning and at the end of the period. And then this data will be submitted to the higher level of supervisor who can review the data, calculations, and check if it is correct or not. And if it's correct, move to the higher level. And if it is not, go back and adjust, and then submit it to the higher level. So these LMIS rules, when identified and the staff be trained on them, minimize the error and increase the accuracy of the data to be the real input of different PSM functions. Also, we have some barriers due to the connectivity if it is web-based or dependent on the internet. Some areas face poor connectivity, so we can make adjustment to move the data from different points as manually or paperwork, and then move to the higher level where we can ensure the reliable source of internet to enter these data. This is a challenge and we have to face. Also, the hardware needed. We need hardware to apply this LMIS, and we need this hardware to be updated and secured. And somehow budget allocated for procurement of this hardware. And we need to train the staff and adequate training. What will you do if, and who will you refer if you face 1 and 2 and 3 scenarios? So this is a plan, but we need to follow, and for any investment, we need to identify the benefits and the cost, and then we can make the best decision to overcome these challenges and not to make me pay more money. This is an example. Also, we have some quality check. If we can face some data to be transferred to another report to be exportable, and we make like calculations to ensure the accuracy of the data entered. So this is an example. Okay, thank you.
Okay, fine. Then let's move on. The challenge in Ethiopia is if one program ends support to the Ministry of Health, for example, GSI, the software system had to be changed. That is really unwanted, unsustainable. How do we get sustainable LMIS? How do we get sustainable systems?
I will suggest, as we hear that the procurement staff will not only responsible for just procuring products, but for advocate how to gain the acceptance and the support from different authorities. If we can talk to the higher level of the Ministry of Health representatives to explain to them the importance of this system and the impact of applying this system. And if we change the system into other system or manual or paperwork system, so this will affect by and listing these effects. So we can advocate to continue. And somehow we make sustainability plan before the introduction of the new interventions. I suppose that before we, as a GSI, who are responsible for this development of the software, we will make a sustainability plan, who will responsible for continuous capacity building, how to continue working with this system. So I refer to check what is in the sustainability plan to ensure not to change or minimize the changes expected for the LMIS. Thank you.
Okay, then the next one. My question is from part 1 of the presentation. How do you link LMIS at the service delivery points, assuming there are manual with the LMIS at central stores, which is electronic, especially relating to data accuracy and quality, since there are 2 different systems? I think you've worked with that often enough, so you can tell us your experience.
Yes, okay. We have at the service delivery point, we have a form, and this collect the data related to the LMIS. Okay, could you mute your mic, please? Okay. Okay.
Go ahead.
Okay. So as a service delivery point, we have this form, which is written at the end of a specific identified period of time at the end of the month, for example. And then we enter the data, the started stock level and the ended stock level and the average monthly consumption. And at the end, what is the status of my stock? And this paper document is submitted to the district level, who collect these forms from different service delivery points and make a table including these different service delivery points and review it to check any data error to avoid before transferring from this step to the higher level. And then, this every step with a specific time and schedule. This is from day 30 to 31, the first step. The next step at the district level from day 1 to day 3 of the new month, and then transfer to the higher level, who will enter this data on an electronic system and gather all information, including the warehouses, not the service delivery points as well, and make the calculation and to be submitted to the central level. This is the process. So we talk about the manual system and the electronic system and the data accuracy. So at the higher level, which is the directorate level, they make the entry of the electronic documents collected manually before to be entered on the electronic IT system. And then these data is visible for them and for the central level, who can make the decision for resupply or on-site visits or any supervision needed as a quality check. So it is done, and we identify the roles of the central level if they found any mistakes or errors appeared to adjust. And also, when we made the quantification exercise, we reviewed the LMIS data. We make using the electronic data. And when we face some changes, you have the consumption data or service data, and you have some variations, which is unexplained. You need to check. So we go back to the paperwork and check if this data entered correctly. And then if it is entered correctly, okay, we can brainstorming to identify the reasons of these changes to avoid any seasonality, or identify if any seasonality occurred, or identify any barriers. For example, if the lacking of service providers, stop working of some service delivery points, for example. So these data collected and analyzed. And when we made the quantification pre-review exercise, we make it at quarterly level. So every quarter we gather the data and review it. Review the data from the LMIS electronically. And again, if we face any changes, we can check with the manual if needed. But after some time, you are confident about the stuff and they familiar with the process, and the data entry errors were minimal. So hope I answered your question.
Okay, is it possible to receive the slides after the presentation? Yes, we do send them out. If you have not received them, please contact Priya. I'm sure that you will get them.
Thank you.
Okay, I think we're coming to the end of time anyway, and we seem to have run out of questions there. So our thanks to everyone, and particularly to Nancy for sharing her experiences and for such a very clear presentation. I'd just like to take 1 or 2 minutes to summarize some key points and particular experience that she brought to this situation, and stress again the interlinked situation of procurement and supply chain management. Too often we think in silos. We're just procurement, and we don't think about the overall operation. Warehouse, storage, inventory affects procurement. Procurement affects inventory. It's all interlinked, it's all connected. And these support services we talk about in this module are all interconnected. And we have to learn how to work with them. We can never get modern procurement methods if we don't bring finance with us, if they don't understand, if they don't permit and allow what we're doing. We can never bring effective distribution if we don't have good transport systems, and bringing those together as well. We can never have effective medicine importation if we don't work with customs and clearance and all tax-free, all that situation as well. They're all the support services. We have to learn to work with them. And again, it's not enough that you know about this. You have to be able to advocate and explain all of this to non-PSM people. Often finance just don't know how we work. And that's why they say no all the time. We have to try and explain to them. And that means embracing these support services, working with them. It does not mean that you have to become a financial expert or a computer expert, but you need to know enough to know that when you need expert knowledge, how to obtain it and how to use it. Okay, that's enough from me. My thanks to all. Nancy, would you have any last words for us?
Really, I enjoyed this session and enjoyed being with you. And we'll see you, inshallah, next time. Thank you so much.
Okay, shukran, Najala. Priya, anything from you before we close?
Yes, of course. Thank you, sir. As usual, thank you for your support and your time. And a special thanks to Nancy. Thank you so much. We really enjoyed the session and the PPT were really good. So I will forward the PPT just right away after this session to all the candidates, and recording will be updated on the YouTube channel soon. Okay. Thank you so much. Thank you again. Thank you, Prof.
Goodbye to all. Bye.
Thank you.
Thanks for being with us today.
Bye.
Thank you.
Bye bye. Goodbye.
Thank you very much.
Thank you.
That's great, Nancy.
Thank you. See you.
Thank you, Nancy, for the presentation. Thank you so much.
Thank you.
Thank you. All right.
Thank you.
Thanks a lot, Bye.
Your name is not T. Your name is Cho. Godfrey. And then pressure. All the things in my element.
Like, you play this for this thing of a shop. Yeah, we come here.